Pick me up now, every day. Pick me up from the bottom up to the top, love, every day. Paying no mind to taunts or advances that take my...
What can we do to help people with limited access to health care?
As future doctors, there are multiple things we can do. The CFC is doing its best to help people who cannot afford health care.
Our mission is to provide quality medical care at no cost to patients and to provide educational experiences to healthcare professional students who volunteer.
We primarily serve the uninsured and underinsured population of the greater Columbus area. However, anyone in need of care is welcome. Here, a nurse and CFC volunteers are teaching a diabetes educational course prior to the opening of the clinic. These classes are held once every few weeks.
At the Columbus Free Clinic, we see a variety of patients from different cultural and socioeconomic backgrounds. Here, we help them find the care that they require.
Columbus Free Clinic, what it brings to the community, I think, is about 30 to 40 patients each week who obviously have medical needs and economic resources that are somewhat limited. And they show up, and it's an opportunity for both the students and attending physicians to get a chance to know their medical problems and help them with their medications and management of their chronic diseases. And sometimes we have patients who require referrals beyond what we can provide, and so we're able to do that as well.
There.
Here at the CFC, we have lab tests to help patients diagnose and monitor their conditions, as well as provide med students with a chance to practice their lab skills.
You know, when you're a student here at the CFC volunteering, unequivocally you're helping somebody, unequivocally you're doing good with somebody, and that's just a great feeling to have. It's a feeling that, you know, sometimes med students don't get a lot early in their training.
Here at the Columbus Free Clinic, we provide our patients with numerous services that aren't always associated with the clinic. We're able to connect our patients to a wide network of specialists throughout the Columbus area, as well as provide them with access to free diagnostic testing.
Why CFC? Well, it's the spacious desk facilities that I have here that I like to work at. But beyond that, really there's two reasons I work here. One is I actually think we're doing some good helping patients and helping people who can't necessarily afford to help themselves. So I think that's an important part. I buy into the mission. But an equally important reason for me is the medical students. And being able to contribute to their education, increase their enthusiasm for medical care and working with them, teaching them a few things. And so my focus has mostly been on the medical students through the years.
The CFC is great for medical students because they get practice working with their own patients. They get to take vitals, take histories, and present to attending physicians.
Here at the CFC, we provide free prescriptions to patients who may not have the resources to obtain the medications they need. We also have volunteer pharmacists here to advise patients about where they can get their prescriptions filled at commercial pharmacies at a lower cost.
Well, what the CNC has done for me, it has given me hope. It has given me a chance to really get myself back together as far as getting medicated, because I have high blood pressure, and you know they gave me medicine for my high blood pressure. If it wasn't for these guys here, I wouldn't have the medicine for my high blood pressure because I'm not working and I don't have no type of insurance. I really appreciate these people here.
The CFC is a great way to give back to our community and is an important resource for medical students to practice interviewing, treating, and caring for patients.
Seeing what the CFC does in the community has been very awesome. They provide a great level of care and resources for a lot of people in the community that otherwise simply just couldn't afford it. So it's really great to see people getting helped.
What most people don't know about the Columbus Free Clinic is that we can help patients with non-medical concerns as well. We can get power turned on, help with heat and air conditioning. We can also help patients with chronic conditions get long-term medication, such as for diabetes and asthma.
A great thing about the Columbus Free Clinic is that it actually is free. We provide our patients with free doctor's visits, free lab testing, and free prescriptions, all through grants and the generosity of our donors.
Here at the CFC, nurses, pharmacists, and physicians volunteer their time both to help patients manage their health care and provide an excellent opportunity for medical students to gain clinical experience.
But I go home so excited and happy and upbeat because of feeling I've done something good for somebody, and all the students here that are learning. It's just such a win-win situation to be able to help the community, help students, and we think it's not helping us docs, it's helping us a lot too, because we really gain perspective on society and the needs of our society. So it's done an awful lot for me, and I enjoy being a part of it and hope to continue that for a long time.